Hi, hello, this is Dr. Cidambi. I am going to talk about a question that was asked by a viewer. He said that his friend was getting some rehab for drinking and has done several rehab treatment, but then continuously keep relapsing. So this viewer is asking me, how can this cycle be stopped? Is there anything that we can do differently other than just going in and out of rehab? So we're going to dive right into, there are treatments that we can use after doing the rehabilitation. While in rehabilitation, they can even start them on an anti-craving medication. So let's really jump right into this. All right. MAT, it is the medication assisted treatment for alcoholism. This is a very fascinating area of treatment. How effective is this whole approach of doing therapy and also doing medication assisted treatment? This is a complex treatment for alcoholism. What is, I just want to say, like, it's like the medication with behavioral therapy can be combined today. It's like a two-pronged tactics. So you are doing the physical and the psychological aspect of addiction, which is for alcoholism. The biological need for alcohol, and the other hand, the tools and the strategies to deal with the mental, emotional side effects, side of the effects that it goes to have the triggers that makes them go back to coping with alcohol. So you're basically empowering these people to really be able to have that power to make the long-term changes. So it's a sustainable recovery. It's not just to stop it. So what are we talking about medications? What kind of meds can we use? There are five main medications that we can use: naltrexone, acamprosate, disulfiram, topiramate, and baclofen. They all work in slightly different ways. So naltrexone, it works by blocking those opioid receptors in the brain. So the ones who are involved in the feelings of pleasure from alcohol. So by blocking those pleasure centers, it takes away the rewarding feeling. It's like if the alcohol doesn't give you that buzz anymore, you're less likely to crave it. It levels the playing field, right? That's all it does. It's not that you don't want to drink. The drinking itself doesn't do anything for you. So you're removing that positive reinforcement that drives the addiction by using naltrexone. So now let's talk about the acamprosate. It's a little different. It kind of works on stabilizing the brain chemistry, the glutamate system. So that's where, by stabilizing the glutamate system, it reduces cravings. So it's restoring balance instead of blocking the reward. It helps the brain heal and function normally. The disulfiram, or disulfiram. So this is an antabuse, and it takes a more direct approach. So basically, it's someone drinks alcohol while taking the disulfiram, they go through the nasty side effects: nausea, vomiting, headaches, flushing, racing heart, you name it. It's not a pleasant experience. So it's meant to be a deterrent, really, like make people think twice before drinking. It's not making the drinking less enjoyable, but it's strong aversive therapy. So, it makes you feel sick. So the psychological side is the behavioral therapy is what we are going to talk about. These therapies are crucial because for a long-term recovery, they teach people how to manage the cravings and the coping skills. There are different types of therapies that you can use. One of the most well-known is cognitive behavioral therapy, or CBT. We've talked several times about this. It's about changing the way you think about and respond to alcohol. So you're identifying these negative thought patterns and behaviors and you're working on replacing them with healthier ones. If someone is used to reaching out to the bottle every time they get stressed, CBT is going to teach them how to respond differently. And there is motivational interviewing, it's called MI. So MI is slightly different, and it kind of taps on the internal motivation. We are not telling people what they should do. We are helping them to dive into their own thing, to find out, they explore what is the reasons for them to change. So you're empowering their recovery process. So we did both CBT and MI. There are like CM, DBT, family therapy, so contingency management is CM. It uses the positive reinforcement, like rewards. So you're earning rewards for staying sober. That's great motivation. It's DBT, dialectical behavioral therapy, and that one is all about helping people manage their emotions. It could be, learn how to cope with stress and how to deal with the difficult situation without turning to alcohol. So these intense emotions are triggering people to seek out for faulty coping mechanism. Then the family therapy, because addiction affects everyone in the family. It's not just the individual who is drinking. So it's the family therapy gives support to the person in treatment, and also for the addressing the any relationship issues that might be contributing to the problem. So it's really creating a healthier environment for everyone. It's a holistic approach to everyone. So this is so far we talked about the medication and the therapies, right? So does it all actually work? How effective is this therapy? The research have really given 50 to 70% of reduction in drinking days, those who go through MAT. So 50 to 70%, guys, if you take this medication, 30 to 50%, like you're going to be decreasing the amount of drinking. So significant changes in the drinking habit. So those changes will really give to real life benefits. So we see improvement in mental health, better cognitive function, and people are thinking more clearly, they're feeling better emotionally, and of course, much lower risk of relapse. So those who are going through MAT, are they going to be sticking to this treatment? Seriously, MAT helps with the treatment retention. Staying with it long term will make them see the benefit. So it's really it's like really MAT is a real treatment that people should turn to, so that this cycle of relapse and going back for detox really stops. So it makes me wonder, considering how effective MAT treatment is, what are the potential benefit of it's the accessibility to everyone? That's the key. We need to increase the access to MAT treatment, because it's a medical condition and you need to treat it like any other chronic disease. And so on that, I hope it really answered your question. Thank you for spending the time with me, and until next time, bye-bye. Have a great one.